بسم الله الرحمن الرحيم. نكمل موضوع local anesthesia in dentistry. What is local anesthesia? Local anesthesia are drugs that block nerve conduction when applied locally to nerve tissue in appropriate concentration. فهذا هو one of drugs that stop any sensation that travel from nerve end to the brain. We have many classifications for local anesthesia, but one of the important ones is depend on the route of administration and duration of action. So, if the route of administration either parenterally as injectable in local anesthesia or topically. The parenterally we have three types: the short-acting, the intermediate-acting, and long-acting. The short-acting as procaine, chloroprocaine. The intermediate-acting as lidocaine, prilocaine, and long-acting as tetracaine, pivikin, and pivikin. This is injectable anesthesia. But the topical anesthesia as cocaine, lidocaine, tetracaine, lidocaine, oxazine, and pivikin. This is topical anesthesia. The advantage of local anesthesia: first, the technique of local anesthesia are easily mastered. The equipment required is limited in amount. The local anesthesia is economical. It is easily transportable. The patency of the airway is not impaired. The anesthetic can be administered by the operator. So any dentist can give a local anesthesia, not need any specialty in local anesthesia like in general anesthesia. It enable the patient to cooperate with the dentist to facilitate his own treatment. الاستطاع أن التواصل مع مريض في حالة اللوكال anesthesia, not like the general anesthesia, we cannot communicate with the patient. Usually, preoperative preparation of patient is not required. The patient can leave the surgery unscarred and often return to work after a local anesthetic has been used. في حال استعمال اللوكال أنستيزيا يستطيع المريض أن يرجع إلى عمله أو إلى مكانه بالوقت الذي ينتهي عمل طبيب الأسنان. The contraindication of local anesthesia: first, the presence of acute infection at the site of operation. Second, the patient afflicted with certain rare hemorrhagic diseases such as hemophilia, Christmas disease, or von Willebrand disease. And lastly, some patients acquire accessibility to certain local anesthesia, so we cannot use this type of local anesthesia. Now, we discuss with you the chemistry of local anesthetic drug. We have two ends. The first one called lipid solubility and second one called water solubility. The lipid solubility help in migration of active drug into neuronal fiber, but the water solubility is to get the drug to the site of action from the site of administration. So traveling of the local anesthetic drug from the site of administration to the nerve end is by water solubility, but is migration from outside of nerve cell to the inside of nerve cell by lipid solubility. We have two types of local anesthetic anesthesia according to its chemistry. We have amino acid. The end of the chemistry of local anesthetic drug is lipophilic aromatic residues, but amino esters, the chemical structure is end with hydrophilic amino group. So it is the main two group, either amide or ester type. The mechanism of action of local anesthesia. Local anesthetic prevents the generation and conduction of nerve impulse. So when stop formation the impulse, we cannot travel this impulse to the brain and not have any sensation that's present. The primary mechanism of action is blockage of voltage-gated sodium channel. We have got sodium channel in the axon of the nerve fiber. So when blocked by local anesthetic solution drug, so not transmission of sodium channel from outside to inside, so not formation of any impulse. The local anesthetic diffuse through the cell membrane and bind to the voltage a sensitive sodium channel from the inner side of the cell membrane. They prevent the increase in permeability to sodium ion and gradually raise the threshold for excitation. With increasing concentration, impulse conduction's low rate of rise of action potential decreases, and finally the ability to generate an action potential is abolished. So no formation of impulse travel through the axon of the nerve. This results from binding of local anesthesia to more and more sodium channel. Thus they prevent the generation of an action potential and its conduction. في هذا اللوكال anesthesia هو فقط block the sodium channel. في حال انه block the sodium channel, so no any impulse formation. But if they not close the sodium channel, the impulse formation and travel the pain brain. The mechanism of action local anesthesia. In this figure we can see we have sodium channel blocked by the local anesthetic drug, so not enter from outside of cell to inside of the cell, so that have no any action potential, so the no any impulse formation. The small nerve fiber are more susceptible as they present a greater surface area per unit volume. So when have a small fiber, the surface area is more, so that have impulse can stop by the local anesthetic solution. Those small fibers, autonomic fiber, are blocked first, followed by sensory fiber, conduction, pain, temperature, sense, then touch, pressure, and vibration. The first nerve fiber that stopped by local anesthesia is the pain, and then the temperature, and then the touch and pressure and the vibration. Sensation in the same order was called difference blockage. Sensory fiber and motor fiber are equal sensitivity. Non-myelinated fiber are blocked more readily than the myelinated because the axon can only be affected by the anesthetic agent at the node of Ranvier. بهذا المyelinated nerve fiber effect by local anesthesia is less than non-myelinated fiber. The local anesthetic solution is different than local anesthetic drug. The local anesthetic solution consists of many chemical structures. The first one is local anesthetic agent or local anesthetic drugs, and second one vasoconstrictor, reducing agent, preservative, fungicide, and vehicle. هذه الأدراج in one mixture and forming local anesthetic solution. So the local anesthetic solution, the first one is local anesthetic agent. The requirement for local anesthetic drug, first, potency and reliability. When the agent is administered correctly in adequate dosage, it consistently produces effective local anesthesia. Approximately 98% of injection using 2% lidocaine with 1 over 80,000 adrenaline solution are followed by effective anesthesia. أفضل anesthesia لحد الآن هي lidocaine 2%. So the potency is more in this. Reversibility of action. The action of any drug used to obtain local anesthesia must be completely reversible within a very reasonable time. يجب أن يرجع النيرف function and return the nerve impulse after the action of the local anesthetic drug is finished. It must be safe. All local anesthetic agents must have a wide margin of safety from poison side effects, which are collective known as toxicity. This margin of the safety is called therapeutic ratio. Procaine has highest therapeutic ratio, followed by in descending order by medivacaine, lidocaine, and lidocaine. The toxic effect of this drug is also increased by inadvertent intravascular injection. The lack of irritation. No injury to or irritant of the tissue should result from injection of local anesthetic agent. For this reason, local anesthetic solution should be isotonic and have pH compatible with that of the tissue, so it is based in its pH. Rapidity of onset. Ideally, the injection of such an agent should be followed immediately by the onset of local anesthesia. It is very important to appropriate the difference between the onset of change sensation, which hurt analgesia, and actual surgical anesthesia with complete blockage of impulse. For example, 2% lidocaine and with 1 over 80,000 adrenaline solution is about 1 minute and 20 seconds is action. بهذا سرعة عمل اللوكال انستيزيا مهمة لعمل طبيب الأسنان. The duration of effect. The duration of anesthesia is longer than is required for dental procedure. The vasoconstrictor and local anesthetic solution affect the duration of anesthesia. Lidocaine solution produce longer duration of anesthesia, followed in descending order by lidocaine, procaine, and medivacaine. فترة عمل اللوكال انستيزيا مهمة لطبيب الأسنان. كل ما كانت فترة عمل أطول فها تعطي تأثير أكثر. فلهذا عندنا plain local anesthesia and with vasoconstrictor. The plain local anesthesia أفضل local anesthetic agent هو lidocaine. The sterility. The local anesthetic agent must be possible to sterilize them without affecting either their structure or properties. Adequate shelf life. Unless the local anesthetic agent is stable in solution and compatible with the other constant, the shelf life of the preparation will be reduced. Most solutions have shelf life of 2 to 2.5 years. الاكسباير ديت مهمة لطبيب الأسنان. يجب أن يكون الاكسباير ديت فترة طويلة، وإلا إذا كان فترة قصيرة يجب أن نشتري كمية محدودة، لأنه إذا صارت اكسباير لا ما نستطيع نستعملها للمريض. Penetration of mucous membrane. Ideally, the drug should have the property of penetrating mucous membrane so that topical anesthesia is practicable, and the best example is lidocaine used in local anesthesia for mucous. The second agent is the vasoconstrictor. The advantage of additional small quantity of vasoconstrictor drug are first to reduce toxic effect by retarding the absorption of constituent. تقليل امتصاص اللوكال anesthetic drug by the capillaries هذه تقلل التوكسيسيتي of this drug in the blood vessel، ويبقى محافظ على concentration in the site of injection. So by confining the anesthetic agent to a local area, it increases the depth and duration of anesthesia لقلة absorption of this agent within the blood stream. It produces relatively lot less field of operation for surgical procedure. في حالة أنه vasoconstrict the capillaries, so close these capillaries and there are no bleeding from the site of injection. We use many types of vasoconstrictor. The main type is adrenaline, or call it epinephrine. It is a synthetic alkaloid almost identical with the natural secretion of the adrenal medulla. The second one, noradrenaline, or call it norepinephrine, a synthetic substance similar to the precursors amine secreted in the human body by monoaminergic neurons in the brain and at adenoneural and myoneural junction of sympathetic nervous system. The last one, the filiprisin, or call it octopusine, a scientifically produced polypeptide similar to that secreted from the human posterior pituitary gland. Both the depth and duration of anesthesia may be modified by amount of vasoconstrictor in solution. In general, the lower the concentration of vasoconstrictor, the less depth and duration of anesthesia. كل ما قلت تركيز الvasoconstriction تقل threat local anesthetic agent. So, the lidocaine solution containing the adrenaline or non-adrenaline in concentration over 1 over 50,000, 1 over 80,000, 1 over 100,000. If you can use this adrenaline or non-adrenaline for a patient who have hypertension or hyperthyroidism, we can give him filiprisin concentration of 0.03 international unit per ml. The third agent is reducing agent. The vasoconstrictor are unstable in solution and may oxidize, especially on prolonged exposure to sunlight. This results in solution turning brown, and this discoloration is an indication that such a small quantity of sodium metabisulfate, which compensates for the available oxygen, is included in solution. So to become shelf life, the expiry date is very long, that put reducing agent. The preservative, the other constant content of the of local anesthetic solution. This modern local anesthesia solution are very stable and often have half shelf life of 2 years or more. Their sterility is maintained by the inclusion of a small amount of preservative such as octopusine, which is included in xylotox. The other agent is fungicide. In several modern solutions, a small quantity of thiamol is added to serve as a fungicide and fungal growth. في الوقت الحاضر لاحظوا انه fungal growth within local anesthetic solution واسعة أن تقلل فترة استعمالها في طبيب الأسنان، فوضعوا fungicidal as to kill all fungal within the local anesthesia solution, so its expiry date is long. The last one is the vehicle. The anesthetic agent and the additive referred to above are dissolved in modified Rinker solution. This itonic vehicle minimizes discomfort during the injection. نستعمل المحاليل أو المكونات التي توضع within local anesthetic solution by modified Rinker solution. The pH of it is as alkaline pH, so it is not painful or discomfort for the patient. What is the pharmacogenetics of local anesthetic drug? The local anesthesia are rapidly absorbed from mucous membrane and abraded skin. The skin not have any injury or not have abrasion that is not go through the skin, but can go through the mucous membrane and absorb and formation local anesthetic agent. The rate of absorption depends on the vascularity of the area, where the area that have more vascular is more rapid absorption of local anesthetic drug and give a good anesthesia. The vasoconstrictor is decrease the absorption of the local anesthetic drug within the bloodstream. The toxicity depends on the balance between absorption and metabolism. So the metabolism of local anesthetic drug that occur within the kidney and go and excrete within the liver and secrete within the kidney, that it is less toxicity. Binding to tissue decrease the concentration in systemic circulation and therapy toxicity. If local anesthetic agent bind to the tissue of the body, it reduces the concentration within the circulatory system. The metabolism and excretion. The ester type agents are dissociated by esterase and in the blood and liver and hydrolyzed to benzoic acid and alcohol. So the ester type metabolism and be hydrolyzed to two components, benzoic acid and alcohol. Some oxidation may also take place in the liver and all breakdown produced are excreted in urine. كل الميتابوليزم اللي تكون في الليفر يكون excretion من خلال urine. The amide type, the metabolism of it is more complex and somewhat slower. It appears that hydrolysis takes place mainly in the presence of catalysis in liver. The products are then oxidized further and some conjunction with the glucuronic acid take place. Finally, congested and uncongested products are excreted in urine, all the excretion of the ester type and amide type by. What's the mode of action of local anesthetic drug? All anesthetic agents are formed by a combination of weak base and strong acid. They are readily hydrolyzed in the alkalinity of the human tissue. The pH of human tissue is 7.4, is more alkaline than acid, to liberate the alkaloid base, which is then free to be taken up by the lipid in the nerve fibers. Since the hydrochloride salt is the most common form in which the local anesthetic agents are used, these processes may be represented by the equation the B anesthetic salt with hydrochloric acid plus NaHCO3 sodium bicarbonate by the pH of the body is 7.4 that release the anesthetic salt and formation of sodium chloride and the H2CO3 is the carbonic acid. What's the pharmacological action of local anesthesia in the tissue? And the systemic action depends on the concentration attained in the plasma. Any local anesthesia can produce systemic effect. Local anesthetic interfere with the function of all organ, which is conduction or transmission of impulse occur. The action of local anesthesia on the central nervous system. We have local anesthetic stimulation of central nervous system and produce restlessness, tremor, mental confusion, and convulsion. تأثير local anesthesia on the central nervous system هي كون restlessness, tremor, mental confusion, and convulsion. In toxic dose, it leads to the respiratory depression, coma, and death. This toxic dose of local anesthetic solution. Cocaine is powerful stimulated while coca and other agents produce less central nervous stimulated effect. أكثر local anesthetic agent هو خطر على السنترال نيرفس سيستم هو الكوكايين ويؤدي إلى الإدمان. The action of local anesthetic agent on the cardiovascular system. Local anesthesia lead to myocardial depressant, decreased heart rate, and amplitude of myocardial contraction. In high dose, they produce change in ECG and may precipitate ventricular fibrillation. Pivikin is more cardiotoxic and can produce ventricular tachycardia or fibrillation. Local anesthetic also produce decrease in blood pressure, which may be due to sympathetic blockage. Only cocaine has property to raise blood pressure due to its sympathetic property. كل اللوكال أنستيزيا تؤدي إلى انخفاض بضغط الدم، فقط الكوكايين يؤدي إلى ارتفاع ضغط الدم. The therapeutic use. What is clinical use of local anesthetic agent? Use as surface anesthesia, as a topical anesthesia. Use as a spinal anesthesia if give injection in the spinal nerve. Use as infiltration anesthesia or use in nerve block anesthesia، وخاصة نستعملها في طب الأسنان هي infiltration and block nerve. We have intraligamentous anesthesia and give anesthesia injection in the ligament, and intraosseous anesthesia, one injection anesthesia inside the bone. For systemic use in treatment of cardiac arrhythmia، حقيقة في حالة وجود زيادة في دقات القلب نوضع اللوكال anesthesia تقلل contraction of myocardial muscle and this treatment of cardiac arrhythmia. The clinical action of specific agent. We have more important agent that use as local anesthetic. The first one is lidocaine, or call it lidocaine. Lidocaine is the first amide local anesthetic and the most widely used. It is fast and long-acting. It's used for all type of anesthesia. Maximum anesthesia effect is seen in 2 to 5 minutes and lasts for 30 to 45 minutes as a plain anesthesia. Allergy to amide type local anesthesia virtually non-existent. This is a major advantage over ester type local anesthesia. حقيقة تأثيرات الجانبية أو تؤدي إلى الألرجي هو قليلة جدا، أقل من النوع الثاني هو الester type. Lidocaine is available in the market as 4% topical solution, 2% gel, 5% ointment, 2% without vasoconstrictor as a plain anesthesia, 2% with epinephrine as 1/50,000, 1/100,000. Recently, 2% with 1/200,000 has become available in the market. Second, local anesthetic agent is brocaine. Brocaine is the first injectable local anesthesia synthesized as ester type. The onset of action between 6 to 10 minutes. Effective dental concentration between 2 to 4%. Brocaine topical anesthetic action is not acceptable clinically. Brocaine is an important drug in immediate management of accidental intra-arterial injection of any drug. If that have give miss injection in the artery or vein, we can give him a brocaine to reduce its effect of drug. The other type of the local anesthetic agent is pivikin. Pivikin is widely used, however, it can cause more cardiotoxicity than others that have effect on the cardiac muscle and its effect on the heart. There are injectable as injection 0.25 to 0.5% with or without adrenaline. Other one, like pivikin, is lidocaine, is a derivative of pivikin that seem to be less neurotoxic and less cardiotoxic effect, أقل تأثيراته on the nervous system and cardiac system, myocardial muscle. Medivacaine, its action is more rapid in onset and more prolonged than that of lidocaine. It is as available as injection 1 to 3%, or nerve block and epidural anesthesia can use it. The last one is the cocaine. cocaine is natural erythroxylone coca، هو مستخرج من ثمرة الكوكا، فهو طبيعي local anesthetic agent which produce euphoria and is drug of dependence and abuse. حقيقة الكوكايين من الثمار التي تسوي إدمان كثير، تؤدي إلى الفرح والشعور بالسعادة، فلهذا سوء استعمالها أو الإدمان على الكوكايين وارد جدا، وهو من الأمور الخطرة باستعمال الكوكايين، فلهذا لا يستعمل الآن كمخدر موضعي في dentistry. It's used as surface anesthesia. It is protoplasmic poison and hence cannot be injected. We have this local anesthetic solution within the market. حقيقة هاي موجودة بالأسواق في تجهيزاتها بالأسنان وفي الصيدليات. هي lidocaine 2% with epinephrine 1 over 80,000. lidocaine 2% with epinephrine 1 over 100,000. وحاليا موجود lidocaine 2% with epinephrine 1 over 200,000 في حالة انه نحتاج العمليات intraoral surgery، فنحتاج الى انه فترة العملية تطول الى ساعتين الى 3 ساعات، فنستعمل التركيز العالية من vasoconstrictor. We have plain anesthesia as lidocaine 2%. We have lidocaine 3% with filiprisin as 0.03 international unit في حالة انه contraindication استعمال الابنفرين or norepinephrine، نستعمل الفليبروسين اللي عنده hypertension، اللي عنده hyperthyroidism أو any disease that lead to have contraindication use adrenaline or noradrenaline. We have plain lidocaine as 4%. We have lidocaine 3% with epinephrine 1 over 3,000 as a vasoconstrictor. We have articaine as 4% epinephrine 1 over 100,000. Thank you for your listening this lecture, and with great thanks, inshallah موفقين. Any question later.